Hello, I'm Dr. Farrell Conant. I'm at Smith County Family Practice, also on staff at Smith County Memorial Hospital. I wanted to take just a little bit of time today to discuss with you some newer recommendations about face mask use in the setting of the COVID-19 pandemic. This is a virus that we're learning more about almost every day. And so recently people have asked and questions have been raised about whether people in the community should be wearing cloth face masks. And the recent CDC guidelines, which I refer to, have given that as an option. Let me explain this a little bit more. This virus is, like most viruses, we believe spread by respiratory droplets. So if we cough or sneeze, sometimes even in talking, and we're in close proximity to another individual and we have that virus, they may be exposed to the virus. There are some recent studies that suggest that people who carry the coronavirus and are not having symptoms, are not ill, may be able to pass on the virus also. So that has led to the question of, should everyone wear a mask, a face mask? The answer is not clear yet. We believe that a face mask could be appropriate, certainly in areas where there is widespread community spread of coronavirus. That is not the case yet here in our locale. It is still an option for patients or for individuals who would like to be safe. Now, by wearing a face mask, it does not keep you from getting the virus. We think it's more likely that it may help reduce the chance that you, who might be asymptomatic with the virus, would be less likely to spread the virus to another person by wearing a face mask. So that is an option. You could wear a face mask if you chose in a setting where you couldn't maintain social distancing. That's still the most important, one of the most important ways of preventing spread. That 6-foot social distancing is very important. Obviously, covering our cough and covering our sneezes, washing our hands frequently, not touching our face, eyes, nose, mouth, because that would be a way of transmitting the virus. So if you choose to wear a face mask, that's fine. We're not stressing it as a necessity at this time. And again, we want to be clear that face masks for healthcare professionals are really in short supply. So if you choose to wear a face mask, we'd like you to devise a face mask made of cloth. You may have a friend who's very adept at sewing, or you may be yourself, and you can go on the cdc.gov website, and they have several different ways of making your own face mask, and we'd recommend that. We do not recommend that you try to buy a surgical mask or an N95 mask. Those are already in short supply, and they should be reserved for those that are taking care of sick patients. So, in summary, the question of whether or not to wear a face mask is still, in our view, not a clear, strong recommendation. The CDC does say that it is you may follow that guideline if you choose. And so if you have other questions, we'd ask you to contact your local healthcare provider or the Smith County Memorial Hospital. Our local health department also is a good resource for any questions you might have. Thank you for your time.